as I was coming out of the more traditional bioinformatic analysis of genomes, actually my lab's artificial intelligence capabilities grew while I was at EMBL-EBI as we began not only to decipher cancer genomes, but also looked at microscopy images of tumors, for example, and then used the first AI tools to understand kind of the microscopic characteristics of tumors and link them to the molecular characteristics, which was one of the key achievements during my time at EBI, to do this really for the first time comprehensively. And I think revealing how closely internet the molecular worlds and the histological worlds are, which people had not quite appreciated, simply because of the lack of tools. People have seen, of course, many patterns and images as histopathologists study tumors, but really making those connections at a comprehensive level was only possible through AI algorithms. Um, and also, we began to work with electronic health records from really large cohorts, such as the UK Biobank, but also national registers through EMBL's wide international network. We could access data, for example, from Denmark, where electronic health records are stored on a routine basis, which enabled us to gain deep insights into how diseases, not only cancer, but develop over a lifetime, and how certain preconditions and lifestyle influences and the future course of health and illness. But this also at a great scale, and using then the tools of machine learning and AI to see patterns and quantify them in ways that could not be done before, was also one of the key innovations during my time at EMBL.
It looks like a lot of the exciting algorithmic developments are happening within commercially focused companies. We've seen this with the development, via Google DeepMind of AlphaFold. And is there a concern that the academic community and open access to these tools might in future be compromised by the scale and the cost of doing this?
It's an important question, but I think there's also one element which is critical, and that is the accessibility of data. And I think there EMBL-EBI is really one of the lighthouses and international, because it stores so much of the world's genomes and other biological data repositories. And in fact, AlphaFold could only be developed because of EMBL-EBI's archives of protein structures. And I think, therefore, making sure that these remain open and also ever growing, I think is key to developing AI algorithms and making sure that this can not only take place at select places who essentially hoard data behind closed doors.
Cancer, at least in part, you could think of as a disease of the failure of the immune system. You touched on this earlier, and the exciting opportunity for using cancer immunotherapies to have your own body destroy the tumor. And I suspect it's very likely that tumors arise frequently and are never seen because the immune system eliminates them. Do you think it might be helpful to look in concert with sequencing the tumors to also be focusing on the immune cells in the same patients to look at how they interact with the tumor and really see it as a co-evolution?
Yes, so it's an area of a very active investigation to do deep profiling of the infiltrating immune cells, to profile, say, their T cell receptor repertoires, to understand which T cells can interact and recognize a tumor. This has been successfully implemented as therapeutics through a CAR T cell, which are specifically engineered T cells to recognize certain type of tumors, such as lymphomas, for example. There is also the area of T cell therapy, which works, for example, for melanomas. And this is still at a research phase, but I think the first results are astonishing. Essentially, part of the tumor is being extracted, and then in vitro, T cells are cultivated that recognize the tumor and then are being reinfused to the patient. So basically, uplifting those that are most effective in fighting the cancer cells and therefore enhancing the tumor anti-tumor response. But it is really an extremely challenging task for the immune system to recognize cancers because one realization is that all our genomes they mutate it because the genome consists of then 3 billion base pairs, which are effectively impossible to maintain across the trillions of cells in our body, simply because of the biochemistry of it, which means you can't maintain it perfectly. So a rough rule of thumb is that most of our cells harbor around 1,000 substitutions, or perhaps 2,000 by the end of our lifespan. And of course, most of them have no consequence whatsoever. But if you just do the math, it means that every cancer-causing mutation is present in a single cell somewhere. Perhaps not many simultaneously, but it is still there. And that means that in a way, the immune system will almost be overwhelmed if it were to spring into action whenever a single mutation arises. We would be essentially walking autoimmunities if that were the case. So the process cannot be, triggered as easily. And I don't think it is fully understood yet where the immunity truly kicks in, possibly at a later stage than we imagine, because there have to be sufficiently many cells around that harbor these mutations in order to be recognized. So it could well be that actually the suppression by the immune system is a relatively late stage effect, and therefore then we need to do all we can in order to boost it because it's already starting as an uphill battle.
Let me put you on the spot and say, how would you predict the next 5 years to develop? Where do you think the technology will have taken us to in terms of impact on understanding evolution of tumors, cancer biology, or any other area of biology?
So I would think there will be many incremental improvements through AI above all. So I'm not, well, I would have a hard time just to point out that one single big breakthrough that's going to come. But I think what I'm very sure is that many levels of will be better understood. And then we will see essentially over time a continued improvement or perhaps even an acceleration in our improvement of our understanding simply because we can investigate things faster and more efficiently. We can avoid more failures, which effectively are part of essentially the scientific approach. But if you reduce the failure rate from 95 to 90%, in fact, then already one has gained something, right? And I would think, therefore, this will become part of the our day-to-day toolkit.